I'm Sarah, and my group was Rachel and McKenna, and we talked about diabetes this week. So a little overview on what diabetes is. It's a chronic health condition that affects how your body turns food into energy. So when you're doing normal chemical digestion, the food is broken down into sugar, and then that sugar is released into your bloodstream. And that sugar's goal is to go into your cells and help produce energy. But in order to do that, insulin has to be released to kind of initiate that sugar to go into your bloodstream. So with diabetes, your insulin isn't being produced, so that sugar isn't being stimulated, and it's just going to sit in your blood, and it's going to compile up, and over time that's going to cause a lot of issues. And there's two chronic types of diabetes, type 1 and type 2, which we'll talk about now. So type 1 is known to be an autoimmune reaction to your cells with not enough sugar in them. And then this can be hereditary and it can be genetic. There's not a way to prevent this, and the cause to this is really unknown. And then the symptoms of type 1 are typically seen in the early stages of your life. So it can be diagnosed as early as like 1 year old or into your childhood. And then for type 2, this is when your body doesn't use insulin well and it can't keep your blood sugar at normal, typical, healthy levels. So about 90 to 95% of people that have diabetes are diagnosed with type 2, and this progresses over time. If you have bad eating decisions or not healthy lifestyle, this is going to really increase your chances of becoming diabetic. So it's really important to keep a healthy lifestyle if you don't want to be diabetic. And then one thing with type 2 is before you're considered to be diabetic, you're in a pre-diabetic state, which is kind of like your warning state before you actually have to take the effects of diabetes. And so then for causes, for type 1, the exact cause is unknown, but what they do know is that it is autoimmune system disorder, which normally fights harmful bacteria, but in this situation, your autoimmune system is attacking your insulin cells, which then your blood is going to stay, or excuse me, your sugar is going to stay in your blood. And then for type 2, again, this is when your cells become resistant to the action of insulin because they're so used to that and you're eating all that junk. So your body is just going to do what it normally does, and it's not going to act upon that sugar in your blood. Again, being overweight is a super big cause in this, and one of the only causes of it, so it's important to keep a healthy lifestyle. And then some symptoms and assessments. There's not really like certain symptoms that indicate you have diabetes, but these are just common ones that can help lead to a diagnosis, which are increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, irritability, blurred vision, slow healing sores, and frequent infection. And then for assessment, so the doctors are first going to start with family history, especially if it's type 1, because it can be genetic or hereditary. So they're going to start with that. And then for physical assessment, they're just going to do a normal physical exam, and they're also going to do a fundoscopy, which allows the doctors to see into the front of your eyes because diabetes can be shown through your eyes. And then finally, for a physical exam, they would also look at your feet because diabetes can be shown through your feet. And then also they would do a neurological assessment, which we'll get more into that in a little bit. So for diagnosis, the doctors are going to advise anybody who has a body mass index higher than 25 and is older than 45 to get their blood sugar tested every year, just to make sure they're not in that pre-diabetic stage and they're not going to have maybe the potential of it turning into diabetes. But then if the doctors actually are testing for diabetes, they're going to do 4 different types of tests. The first one is a glycated hemoglobin test, which indicates what your average blood sugar level has been for the past 2 or 3 months. This is just a simple blood draw that they do. And this is called the A1C. And if your A1C is between 5.7 and 6.4, that's going to indicate that you're pre-diabetic. And if it's below 5.7, then it's normal. And if it's above 6.8, then that is diabetes. The second test they could do is a random blood sugar test. This is, again, a simple blood draw, but it is done at a random time, regardless if you just ate a super sugary meal. They're going to take it whenever, and if your blood sugar is above 200, that's going to indicate diabetes. The third test they could do is a fasting blood sugar test. This is when you fast overnight and then you go in to get your blood drawn again. Again, they're going to do this 2 nights in a row, and if it's above 126, then that's going to indicate diabetes. And then the final test they could do is an oral glucose tolerance test. Again, this is a fasting test. It's done in the morning, but once you come back to the doctor for your blood draw, they're going to have you drink a sugary substance, and then they're going to periodically test your blood sugar for 2 hours. And then if it's above 140, that's going to indicate diabetes. Doctors don't typically do all 4 of these tests. They're just going to do a few of them, and they will pick which ones they are based on your specific case. For treatment, unfortunately, there is no known cure to treat diabetes, but there's a lot of things that they can help do to ease your symptoms. The first and obvious one is going to be healthy eating and healthy lifestyle changes. Eating is such a big part of diabetes, and having an active lifestyle is super crucial. So if you keep up a healthy lifestyle, you're going to be pretty good. So you want to avoid foods that are high in fat calories, and you want to eat lots of food that is high in fiber. And then one thing that can help with this is a registered dietitian, so they can make a meal plan that's specific to you. And then you could get insulin injections. That's also important if your diabetes is progressed enough. And then they could have oral medications. This is an insulin, it's just pain medication to ease some of the symptoms. And then the final treatment is a pancreas transplant. This is for really severe cases, but this is very sought against because it has a lot of complications and is very risky. So this isn't typically used. So for prognosis and follow-up, diabetes can be fatal if you don't treat your symptoms right and you don't listen to your body. However, it's very easy to live comfortably with diabetes if you take your treatment options very seriously. The biggest thing that's going to help you is lifestyle changes, and try to go for a brisk walk, probably every day. That's what doctors recommend. But if you can't do it, shoot for 5 times a week. And then finally, for follow-up, you're going to have yearly physicals and eye exams with your doctor, and it's important to monitor your blood sugar daily, as it could spike and that could cause more complications. And then these are the resources I use if you'd like more information.